All right, everyone, I've been seeing a lot of questions in the comment section of some of my prior videos saying that when people are trying to mew, they're unable to breathe when they mew. Now, I think that, first of all, if you're not being able to breathe when you mew, then just stop, because obviously it would be dumb for you to continue because breathing is important. You know, you don't want to do anything that suffocates you. So, disclaimer, I'm not suggesting you do anything that causes you to not be able to breathe. Second point I wanted to make is if you're not able to breathe when you mew, aka when you place the tongue on the roof of the mouth, including the back of the tongue, especially according to the suction mewing method, then there's two potential reasons for that. Number one, you're doing it wrong. And number two, you simply don't have enough oral volume to be able to mew and also keep your tongue out of the airway at the same time. And I really want to focus on the second point, but first let me address the first point briefly. Are you doing it wrong? And that's why it's causing you to not be able to breathe. The instructions that I give for mewing is that you seal your lips, you move the saliva to the back of the mouth over and over again, you gather it all up, and then you do one final swallow where you actually swallow that saliva into your stomach. And as that final swallow occurs, the back of the tongue comes up and you can feel it come and hit the back of the maxilla, and you want to hold that. Now there's also a little bit of a subtle position back there when that tongue comes up where you're actually blocking the airway. You want to come a little bit more forward ahead of that. You don't want to actually have the tongue be blocking the airway, which is what follows the swallow, because then of course you're not going to be able to breathe. So you got to find that sweet spot where the tongue comes up during that final swallow and it's in a position ahead of where it's blocking the airway, and yet still pretty far back. And you want to hold that with the lips sealed and the suction still present. And that is a sustainable, good way to be mewing. Now for the second point, which is, are you doing that? Are you mewing to the best of your ability and yet still you're not able to breathe when you do so? This is a point that I've been making for a long time. Most of us, and this includes me when I first started, if you do not have sufficient oral volume, you're not going to be able to mew well. Being able to mew presupposes that you have a sufficient amount of oral real estate, and chances are if you're deficient in your facial structure and you're Googling and you Google and stumble upon mewing, chances are you're deficient, right? And so you're most likely lacking in oral structure, which is how you ended up researching this stuff in the first place. And if that's the case, you are going to drive yourself crazy trying to mew yourself out of that intraoral prison. Your tongue is a 6-foot tiger trapped in a 3-foot cage, and you simply can't maneuver it in a skillful way to place it as mewing requires. And so I did this, and I've mentioned this in some other videos. I spent years trying to learn how to mew properly, lacking oral volume, and I simply couldn't get it because I did not have enough playroom to be able to establish that proper tongue posture. The space between my back teeth, it was too narrow for the back of my tongue to come up. My front teeth were too far back. I was too retruded to get the front of the tongue placed up without it wanting to poke through my front teeth. I did AGA. I gained several millimeters of forward expansion. Then I did MSE. I gained 11 millimeters of lateral expansion. And now finally, I feel like I'm able to mew sustainably, habitually, without really killing myself, giving 110% attention just to how I could place my tongue on the roof of my mouth without it being nibbled away with my teeth, or by my teeth, or without it wanting to poke through the front, or without, as you guys are mentioning, without it blocking my airway and me being unable to breathe. The point is this. If you're serious about gaining the ability to mew, you may need to seek out some type of adult orthodontic expansion. And for anyone who watches my videos, you know that these days I'm recommending MSE for that. I would say try your best to figure out a sustainable mewing practice, but just be aware that for some people it's simply impossible to mew sustainably due to a lack of intraoral volume. And this is something I learned through my experience. And I know that people want to use mewing to expand, to avoid the cost of an expander or the inconvenience of an expander. However, it may be a kind of a case where the rich get richer and the poor stay poor, because if you're so lacking in oral volume, right, then you're not even going to be able to start the process of mewing, whereas someone with a reasonable amount of oral volume is going to actually be able to leverage that tongue well on the roof of the mouth and may be able to gain some amount of expansion with the tongue, although the amount of expansion that's able to be achieved with mewing is questionable. Yet mewing is still a worthwhile practice for anyone to do, even if it doesn't result in expansion, simply because it trains the tongue, it strengthens the neck, and it helps define the muscles of the face. However, if you're so deficient that you can't even mew in the first place without, for example, not being able to breathe, then yeah, you're not going to get anything out of mewing, especially with regards to expansion. So you may need to introduce an expander, give yourself, jumpstart the process, give yourself a little oral volume to work with, and that will allow you to then start using your tongue to, if not expand, then to at least stabilize those results and get it out of your throat so that you can maintain proper tongue posture, keep your lips sealed, and establish a good nasal breathing practice, which is really the most important thing in this racket, is learning to, is habituating a nasal breathing practice, especially while you're asleep. So that's it for now. Talk to you soon. Peace out.